Hi, I'm Dr. Herman, and you've been receiving emails from me, or you've come to my website for your specific autoimmune disease, whether that was for an autoimmune thyroid disease called Hashimoto's or multiple sclerosis, or there's a number of them actually, where these autoimmune diseases are plaguing people. What I'm going to do here today with this video is educate you about what an autoimmune disease is. We're going to draw out this whole process and help you really understand what's going on. Because when doctors tell you that you have this autoimmune condition, whether it is Hashimoto's or it's multiple sclerosis or it's lupus or Sjogren's syndrome, you've got to understand that most of them may not be educated as to what the autoimmune condition really is. And then that really leaves them with a weak position on how to treat you effectively and shut down this process. Because the answer really is not in immune suppressant medications. You don't want your immune system to be weak, you want it to be strong. You just don't want it to be stronger than it needs to be. You'll understand that. Let me tell you a little bit about myself before we get into this drawing right now, so you can understand where I'm coming from. I did go to school to become a chiropractor, and I realized very quickly when I got into practice that chiropractic was not the answer for every chronic ailment that people are suffering from, like you and your condition or your loved one who's suffering from a condition. And a few years ago, I was listening to a doctor speak about how brain-based assessments and brain-based therapies can really make life-changing results for patients with all kinds of disorders that people suffer from in today's society. And I decided to go back to school, so I'm obtaining a diplomate in functional neurology, which is very different than medical neurology. Medical neurology, as you probably have already gone to, they run a test and they give you a pill or a shot and send you off to another doctor, another therapist, or a rheumatologist, or somebody in that profession. With functional neurology, we understand about how the brain functions and the nervous system functions, and when you get a chance to come into my office, we'll do a full exam about that. But I really want to focus on the autoimmune disease here. I'm also obtaining right now a diplomate in neurochemistry and neuropharmacology. And one of our greatest mentors, he is brilliant in an autoimmune disease. He has a PhD in immunology. He is one of the best in the world. He's written about 400 papers on immune diseases. And all of this research I'm about to share with you about the immune system is based on his years of research and his labs. And we've got some amazing laboratories that are available to help understand where your condition is coming from and what you really need to do to fix yourself and stop this problem and not live in the dark. Dr. Aristo Vajdani is his name. He's a PhD in immunology. And this is where we're going with neurochemistry and neuropharmacology. Okay, so what I'm going to do here is draw out and describe to you what is causing all the antibodies in your system. Whether you have those thyroid antibodies, or you have MS antibodies, or you have ANA antibodies. You've got to understand what the root cause of that is and how to stop those antibodies from sticking to your nervous system or your thyroid or your brain and wherever that is, okay? So let's understand something. In our systems, we have these invaders. And these invaders, they're called antigens. Antigens are anything from foods to parasites. We can have yeast growths in our intestines. We can have bacteria growths in our intestines. There's even research that shows people who have episodes of anger, and we all do, all of us have stress, right? I mean, you tell me if you don't have stress, and you're the only one that I've met out there. So even stress in our lives, and we all suffer from that, stress causes what I'm about to share with you. Even insomnia. Most of my patients who come in with these autoimmune disorders, again, whether it's MS or it's thyroid condition or lupus and so on, they have sleeping problems. So research has shown that what I'm about to share with you, these different immune cells that I'm going to share with you, inflammatory immune cells that attack your system, they will cause a flare-up, the insomnia, sleepless nights will cause a flare-up of these different immune cells. So insomnia could be another cause. newest research that came out in the last year in 2010 shows us that eating foods at high cook temperatures are changing the proteins in the foods that we're eating, and the body is not able to absorb those proteins, and the proteins create these different immune cells that I'm about to share with you. So another cause of this immune condition could be, high temperature, high temp cooking. Now the reason why I'm listing all of these, because any of these we consider antigens, but you can also call those invaders. Antigens are invaders, okay? Now, what happens here is when the antigen comes into the body, we have these different white blood cells. I'm going to put this up here as WBC, which stands for a white blood cell. There's actually one in particular, but you don't need to know the name of that one. If you really care, I can share the research with you. But what the white blood cells do is they recognize the antigen, the invasion in the system. When the white blood cell recognizes the antigen of the system, it produces another cell. And this is what starts the whole process. It produces an antigen-presenting cell. This antigen-presenting cell now, its job is to call out to your immune system for help, okay? It's telling the immune system, we have an invasion, we have a problem that we need to clean up. So the antigen-presenting cell comes down, and it calls on a T helper cell. Now, before I go any further, let me give you some other words so you're familiar with, or somewhat familiar with. At least you could follow what I'm going to describe to you here. We have in our immune system, right, I'm sure you know you have red blood cells and you have white blood cells, okay? Well, you know the red blood cells carry oxygen to the brain and to the body, and the white blood cells are what fight off disease in our system, right? They fight off your infections and so on. Well, we have different kinds of white blood cells. We have what's called T helper. We have regulator cells. We have suppressor cells. We have natural, I'm going to put natural killer cells. We have B cells. We have T cells. I don't expect you to remember all these. I just want you to understand as I describe this to you, okay? And you can look back at this video again so you can reference some things if you get a little confused. When the antigen-presenting cell calls on the let me step back 1 second. We have another kind of cell called a cytokine. These are inflammatory cells. These cells inflame tissues. These cells are what start the process of creating the antibodies that attack your tissues. Now, when the antigen-presenting cell, because of the invasion that's recognized, the antigen-presenting cell calls on the T helper. The T helper then comes up and sends a signal out in one direction. Let me erase some of these. No, let me erase some of these words here so we can draw this out for you all. The T helper sends the signal out in one direction, and it sends a signal out in another direction. In one direction is the B cells. In another direction, it calls on the T cells. Okay, let me give you an understanding. I like to use this analogy to help you understand what's going on with your immune system. Think of, and hopefully this doesn't hit anybody in a bad emotional way, but I'm going to use a story that happened here in the United States, a pretty bad trauma, chaotic event that occurred. The antigen, think of 9/11, New York City. The plane that hit the building and caused all the chaos. The plane was the antigen. The building is your body, okay? When the antigen invaded the city and hit the building, there were people on the ground who saw this plane hit the building and said, oh my God, what is that chaos? What just happened? A plane hit a building? They picked up their phone and they called 911, besides maybe calling a loved one or somebody, but they called 911. And the 911 operator picked up the phone. So the plane, so-called, the antigen invaded the body. The antigen-presenting cell which is the person who picked up the phone, calls on the 911 operator of the immune system, the helper. The 911 operator now, your T helper cell, has to send a signal out once it got enough signals in and alerted it that there's an invasion in the body. It sends a signal out to in 911, right? It was the police and fire rescue. It sent the signal out to the Army, Navy, Air Force, and Marines. So we had a call on some cells in our system that there was an invasion, there's chaos going on. We have calls going out to another set in our system that there's an invasion and chaos going on. Now, let's step back a moment, okay? When the antigen-presenting cell sends a signal to the T helper cell, it produces an inflammation process. The first cytokine that comes off of this is called interleukin-1. Interleukin-1 is produced, is spawned off of the call from the antigen-presenting telling the T helper. Now, we have more cytokines, more inflammatory cells that are produced when the T helper tells the T cells of our immune system, which is also known as the T helper 1 group or Th1 group. It produces more of these inflammation cells, pro-inflammatory cells, disease cells, cytokine cells called interleukin 2, interleukin 12, interleukin 18. It produces tissue necrosing factor. Tissue necrosing, that means tissue death factor cells. It produces interferon cells. On the opposite side, when the T helper is calling on the other side of the immune system called the B cells, which is also called the T helper 2 response, or the Th2 it's called, it produces an interleukin 4, interleukin 5, interleukin 6, interleukin 10, interleukin 13. Now, not that you have to memorize all of these, and that's not my point of sharing this with you. I want you to understand what's going on here. Again, let's go back. We have an invasion. We have foods. We have bugs, critters, parasites. We have yeast, fungus. We have insomnia. We have anger issues that will develop an antigen-presenting cell that sends out a signal to the T helper, and then it produces this whole inflammation process. Okay? Next, what happens is when the fire is burning so much from so much invasion and we can't calm down the inflammation, we have a third type of an immune response that might occur. And this cell, called interleukin 6, is in the third process. It's like the fire is not burning enough, so there's more gasoline that hits that flame and it just explodes. And this turns into another immune response called the T helper 17 response. So we have another cell, we have an interleukin 6, and some others that are involved in this process called interleukin 17 and an interleukin 23. These three are showing that there's a Th17, that the fire is burning so long that it just can't calm down. And this is a much worse process than what had it originally started out with. So now what we understand in functional immunology, first of all, is this is what the story is of your immune system. This whole process, which we can divide in half, because you're most likely going to be either a Th1 or you're going to be a Th2 process. What we've got to understand is, in order to back this up and calm down the inflammation, you don't want immune suppressing drugs. First of all, you need your immune system to fight a battle for you. But second, if you're just taking a medicine that's going to suppress the immune response and you don't take away what the causes were that started this whole response in the beginning, what good are you getting? What good are you getting done? You know, some patients ask me, well, why didn't my doctor ever explain this to me? Well, you know, first of all, I spend 2 to 3 weekends every month going to school to further educate myself. But second, doctors get in their rhythm, and all they know is what the drug company rep tells them to prescribe to you for this condition. They just don't know, and maybe some of them are better than others, and I'm not here to say that I'm better than them. I just do different things. I understand this immune system in a little more detailed manner than what you're hearing. You've got to understand this whole process that's going on in your immune system is what's creating thyroid antibodies to attack your thyroid. What's creating the antibodies to attack your brain and eat up the brain of the spinal cord and cause lack of electrical firing down the arm of the leg and causing paralysis down that body, or causing rashes of lesions from lupus and so on. All of these different autoimmune diseases, they're all the same. And what Cyrex Labs is going to be able to do for us with Dr. Vrajzdani, the PhD immunologist who I mentioned earlier, is what we'll be able to do is we can run tissue panels and find out where this whole activity, this whole immune system response is, where it's attacking your system from brain to body, which is going to be incredible. It's amazing, it's exciting, and we can help calm down this whole process. So what we've got to do is say, if you just remove the antigens, removing the foods, removing the critters, if we have bacteria or parasites, which I find in, I'd say, every single one of my patients with autoimmune disease, we can clean up that whole system and fix your gut. That's part of this. But then, if you remember the list I said earlier, people who have insomnia. Well, Dr. Herman, I mean, if you just remove the bug, am I going to sleep better? Well, maybe, maybe not. There's some other parts of this that we'll get to in a moment. But Dr. Herman, you said that we have stress. How are you going to stop me from having stress? I mean, I can't go live on cloud 9 on an island somewhere. I mean, let's be real. I mean, I have 3 kids. I have to pay the mortgage and all of that, right? So we've got to understand that what we can do, what we have discovered, and with Dr. Vrajzdani's assistance and his papers, his literature, is that there are certain natural substances that have been discovered where what we can do, and all the papers show, is that we can inhibit the response of the interleukin-1, which is amazing. If we can remove these from your life, at least the foods and the critters, right? We change your diet, we kill what's living in the body, and I find hookworms and parasites on so many patients. When we can do that, but we can also inhibit this interleukin-1 process, because you still have stress, you may still not be sleeping well, and it still can be causing the interleukin-1 production, which still causes this whole reaction. If you can understand so far and follow this, when we can inhibit this one, then we can stop this from calling on to the police and the army to come in and invade the body. Let's take a second again. What's happening here is this B cell is supposed to come down and remove the antigen. The T cells are trying to do the same thing. When we can stop this, to stop this from telling all of these guys what to do, we calm down this whole immune response, okay? We can run specific labs on you to look for these cytokine cells. We can study your white blood cell system. And that's not just a general white blood cell test that your doctors have run on you before. You're not going to see it there, okay? So we've got to run detailed immune cell tests. We can even find out if you have an active response going on in your system to these different things living in the body, bugs, foods, and stress, and so on. And we can find out if your immune system is just, for years of battling these different stresses in your life, if the immune system has gotten dysregulated. Is it out of order? That helps us understand more about what's going on with you and how we can safely and effectively help you get well, okay? There's something else that you've got to understand. Hopefully you get this picture of the immune system. I think that's pretty good, okay? And if you got a couple of questions, write it down. We can answer your questions. But there's something else you've got to understand here, is that when your immune system is flared up, there's 2 other parts of your body that get flared up. You have a nervous system that controls everything, and you also have what's called an endocrine system, your whole hormonal system. We call this the neuroendocrine immune axis. It's a cycle. So I want you to think of something here and understand something about the neuroendocrine immune axis. When we take out, if you've ever had a domino set, and you take out dominoes and you put them on a desk, right? You stand them all up and they're all standing up. When you have this immune response going on, and let's say that's domino number 1. I hit domino number 1 and it falls down. What happens to all the other dominoes in that row of dominoes? Do they stand up or do they fall down? They fall down, right? When they fall down, they cause a flare-up of your nervous system. They can cause a flare-up of your endocrine system. Everything else goes wrong in your body. You've got to be able to look at every little part of your system and calm down the whole inflammation. And what we do different as well with calming down the immune system is with functional endocrinology and with functional neurology is to build back up the system and make everything stronger. You've got to be able to rebuild that house. You've got to be able to put out the fire and calm down the whole stress, calm down the chaos, and build the house back up. And that's what we can do for you. There's one more point, that I did forget to share with you, is that research in the study of functional endocrinology tells us that even for females who have gone through menopausal changes, or even some women who are having hormonal imbalances all through their life, through their cycles. They're having strange menstrual bleeding, they're getting headaches at their period, women who are still having hot flashes 20 years after their hysterectomy was done and so on. Whenever these hormonal changes are going on and the estrogen levels drop, this is another piece of research that Dr. Vajani shared with us. When the estrogen levels drop, we get a sudden inflammation of these inflammatory cytokines, and you will automatically have an autoimmune disease that developed. You go to your doctor, you take a thyroid medication, and that may not be all that you need, okay? And for every other disease that you're suffering from. I hope that you can understand from this drawing and from the understanding of the neuroendocrine immune axis what's going on here. Again, most patients will ask me, and I've shared this with doctors before, and they just say, why is it that we don't know this? And why is it that my doctors don't know this? And it's just because they're not continuing their education in the right way. So what I'm doing here, again, is to help educate you about what's going on with the immune system, to understand that you can actually, without medications, calm down this whole system, remove what's stressing it, and stop the cascade of these inflammation reactions from going on, and allow your body to come back to normal. So I invite you into my office, and hopefully by this point you or your loved ones will really understand this point of view and what we need to do for you. So I look forward to meeting you. Again, my phone number is 954-370-3100, and I look forward to helping you. Thank you.